Hi, it's me again. Listen to this. Medicare Part C plans with extra benefits like getting money.
We interrupt this program to bring you a special report.
Hey everyone, this is Rick MacDermid with Senior Solutions Group, and we help people with Medicare. We help educate, inform, give people the most up-to-date, accurate information possible so you can make an informed decision for all things Medicare and retirement planning. If you haven't done so already, please subscribe to our YouTube channel so we can get this information out to as many people that can benefit from it as possible. So we're going to talk today about, we have a lot of clients that have Medicare prescription drug coverage. And often the first part of the year, whether it's January, February, maybe March or April, we'll get a call from a client either in a panic, wondering what the heck's happening when they go to their pharmacy, expect to pay a certain amount for a prescription, and lo and behold, it's way more than they were planning. So we try to help our clients during the fall open enrollment period, which goes from October 15th through December 7th, to find the most suitable prescription drug plan for them. And each person's different. Everyone has different drug needs, different pharmacies. And so it's not an exact science by any means. As a matter of fact, a lot of Medicare agents like to avoid this because it doesn't pay the agents very much at all. All the money is made with selling Medicare Advantage plans or Medicare supplement plans. If you want to find your drug plan, we'll just call Medicare and they'll do all the work so we don't have to. It's not our approach. We want to help people as much as we can save money and be a resource for people. An article I came across here the other day, this is the NPR website. The article is entitled "Drug Plan Prices Touted During Medicare Open Enrollment Can Rise Within a Month." And this is a case study of a person, in this case, Linda Griffith. And we'll have the article linked so you can check this out on your own as well. Linda Griffith signed up for a new Medicare prescription drug plan during last fall's open enrollment period, so in 2021, between October 15th and December 7th. When she tried to fill her prescription in January, she picked up a Humana, in this case, drug plan for its low prices to help with her longtime insurance agent who helped her, and the Medicare Drug Plan Finder, which is this site right here off Medicare.gov, which we frequently use. So it's an online tool that you can use to compare your prescription drug plans year to year. So the drug in question was dextroamphetamine, used to treat attention deficit hyperactivity disorder. Her pharmacist told her that she owed, instead of $70.09, she owed $275.90. So imagine if you went to the store and the cost for these little guys, these little cool oranges, easy to peel by the way and very tasty, if the cost were $2.99 a pound, you went to the checkout counter and it was $4.99 a pound or $5.99 a pound, would you still buy them? Well, I wouldn't. I would say, hey, I don't want these oranges, give them to the cashier and they can give them to the produce manager who can restock them. Or you can go to another store and get them for a better price if these are the oranges that you really want. In this case, though, if you're on a prescription and it's a certain drug that your doctor prescribed, you can't just say, well, I'm going to get a different drug for less money on the spot. You're kind of stuck. You can't just change your drug plan in January if you've already made your selection between October 15th and December 7th. Medicare does not let you change your drug plan in most cases unless you meet certain special requirements due to your low income or if you move to another state, for example. So in this case, she didn't pick it up because she thought something was wrong, said Griffith, 73, retired construction company accountant who lives in Northern California. To me, when you purchase a plan, you have an implied contract, she said. I said I'll pay my premium for this plan on time, and they're going to make sure that I get the drug for a certain amount. So in this case, she went to Medicare.gov. We have the drug right here. We entered off Medicare.gov, dextroamphetamine, and we can add that on Medicare, and we can add as many as up to 5 pharmacies here, which we did. We entered Rosar's, which is a local pharmacy here in the Northwest, Safeway, which is more of a national chain, Walmart, which of course everyone knows they're national, Rite Aid, and mail order pharmacy. So once you put your drug in, your pharmacy's in, hit done, Medicare will show you which plan will be the most cost-effective plan based on your prescription. In this case, the AARP Medicare RX plan through Walgreens comes up number 1. So we'll get back to that in a moment. So a recent analysis by AARP, which is lobbying Congress to pass legislation to control drug prices as we speak, compared drug makers' list prices between the end of December of 2021, shortly after the December 7th sign-up deadline, and the end of January of 2022, just a month after the new Medicare drug plan prices, researchers found that the list prices for 75 brand name drugs and the most frequently prescribed to Medicare beneficiaries has risen as much as 8% within a month. Now we're dealing with inflation right now, but that'd be kind of like going to a restaurant, another analogy, food analogy, because I like food. So what if you went to a restaurant and ordered a cheeseburger with bacon, crispy bacon, fries, a house salad for $15.99 at your local eatery, and you get your bill, and the waiter hands you the bill, and instead of $15.99, the price is $39.99. Well, diesel's higher, beef's higher, dairy products are higher. We had to change the price because of inflation. We have to. We all know what's going on right now with our economy with inflation. And we didn't have time to change the menu because that cost money to reprint the menu, and it was oops. So what are you going to do? Are you going to go back to that restaurant? Probably not. You might pay that bill for that time, but what if you need to get a refill for that prescription month after month after month? You don't have any recourse in this case. So you can't just change your drug plan like we mentioned. So Medicare officials are acknowledging this is going on. They are, and again, we're going to link this article. So your plan can raise your copay mid-year. Usually it happens either in January or July. So the drug manufacturers usually change their prices in January and occasionally in July. And it's kind of like a car sticker price. So what you see on the sticker price is just the starting point for negotiating discounts. In this case, between the insurers, the insurance companies, and pharmacy benefit managers. So the discounts that insurers or their pharmacy benefit managers receive don't typically translate into lower prices for you. Instead, these savings are used to reduce premiums for everyone and to slow premium growth for all beneficiaries. So let's keep that drug plan at $29.30 a month or less, maybe a little bit more. Spread the cost out for everyone for the premium, but for you who needs this drug, dethoamphetamine or whatever the name of it is, you're going to have to pay. Now you'll notice some of these pharmacies are out of network, some are standard, some are preferred in this case, preferred network pharmacy. Walgreens is a preferred pharmacy on this plan. We did not include Walgreens in this case. But you'll see the cost for that drug for the year is $625. And if we want to find out what this price is, let's say you go to a Safeway or a Walmart to fill that prescription. Your total cost is going to be $899, almost $900. So these prescription drugs can be a tier 1, tier 2, tier 3, tier 4, tier 5. A lot of these prescription drug plans are charging a percentage. So we'll see that instead of having a set copay, you're going to pay a percentage of the price for that drug. So the potential for surprises is growing. More insurers have eliminated co-payments, a set dollar amount for a prescription, and instead charge members a percentage for a drug price or co-insurance, which is what this 40% is here, instead of a set copay, such as a $0 for a preferred generic, or a $10 for a generic, or a $40 for a preferred brand drug, which would be a tier 3 drug. So this one drug is often a tier 4, or it could be a tier 2, depending on what plan you're on. So if it's a tier 2, you might pay $10, but if it's a tier 4, like it is with another carrier, it could be 40% of the cost of that drug, of the negotiated price. So Medicare is coming out with a ruling just this last week on April 29th, which we're going to discuss in a moment here. So CMS is looking at ways to make drugs more affordable without waiting for Congress to act. April 22nd, CMS, Center for Medicare and Medicaid Services, unveiled a proposal to streamline access to Medicare savings for people on low income. So that could affect people on low income, but the average middle income person will probably not qualify for those savings. So when CMS approves these plans, which are sold to beneficiaries on Medicare, the only part of drug pricing it approves is the cost sharing, or the tier, applied to each drug. Some plans have as many as 6 drug tiers, which we just looked at a moment ago. In addition to the drug tier, what the patient can pay depends on the pharmacy, their deductible. Right now, the Medicare standard deductible for Part D is $480. It went up from $445, so costs are going up. Medicare Part B premium's gone up almost 15% this year. Costs in general are going up across the board. So a lot of these people are just saying, I'm not going to fill my drug. Or I can maybe pay cash and get a discount through a discount app, such as GoodRx. So after Linda Griffith left the pharmacy without her medication, she spent a week making phone calls to her drug plan, her pharmacy, Social Security, and Medicare, and still couldn't find out how to lower the cost for her drug. So finally, she just had to give in and make the payment because she needed those drugs. But she didn't give up. She appealed to her drug company, who denied her appeal 2 times. And you can read the full article right here off our link. So a lot of these people, like our clients, are dealing with this on a day-to-day basis. And it might be that you're on more than one drug. You might be on 2 or 3 of these high-cost drugs. So it's a struggle. If you're just on generic day-to-day maintenance drugs for cholesterol and blood pressure, you're not dealing with this. But if you're on these tier 3, tier 4, or tier 5 drugs, this is a constant battle. So CMS, in their ruling on April 29th, we're going to skip down. There's a link to it. There's a link to the actual final ruling, which is over 600 pages. I don't suggest you read that ruling. But the actual ruling here, we're going to have a link to it as well, the summary of it. They're going to post the final summary on May 9th, which is coming up here next week. So in recent years, more Part D plans, prescription drug plans, have been entering into arrangements with pharmacies that may pay less money for dispensed drugs if pharmacies don't meet certain criteria. The negotiated price for a drug is the price reported to CMS at the point of sale, which is used to calculate beneficiary cost sharing and generally adjudicate the Part D benefit. With the emergence of these payment arrangements, the negotiated price is frequently higher than the final payments to pharmacies. Higher negotiated prices lead to higher beneficiary cost sharing and faster beneficiary advancement through the Part D benefit, other words known as the coverage gap or the donut hole, which we talk about in other videos. CMS is finalizing a policy that requires Part D plans to apply for all price concessions they receive from network pharmacies to the negotiated price at the point of sale, so that the beneficiary can also share in the savings. Specifically, CMS is redefining the negotiated price as the baseline, or the lowest price possible payment to a pharmacy, effective January 1st of 2024. So not next year, but the year after. CMS is applying the finalized policy across all phases of the Part D benefit, so through the deductible, the first phase, the donut hole, and the catastrophic phase. This policy reduces beneficiary out-of-pocket costs and improves price transparency and market competition in the Part D program. I read through part of that 600-plus page ruling, and it looks like it might reduce drug costs for about maybe 3% nationwide. So a little bit helps. It's not going to solve all of these problems. So again, Congress really needs to give Medicare the ability to negotiate drug prices from the drug manufacturers. That would really help with this as well. Another part of this ruling, which is a different topic, so you know those ads you see on TV with these celebrities? CMS is finalizing changes to marketing and communication requirements that will protect Medicare beneficiaries by ensuring they receive accurate and accessible information about Medicare coverage. These include strengthening oversight of third-party marketing organizations to detect and prevent use of confusing or misleading activities to enroll beneficiaries in MA or Medicare Advantage or in Part D plans. So we're going to see a little clip here of one of these celebrities touting all the free stuff you can get.
Make sure you're not missing out. It's simple. 1, call the number on your screen. 2, they'll look up your zip code and see if you're eligible. 3, they'll check for plans with extra benefits like prescriptions, dental coverage, and the benefit that adds money back to your Social Security check every single month. Call now.
So there's some other things they talk about: disaster, emergencies, past performance, network adequacy. So if a new company wants to bring in a Medicare Advantage plan, they have to have an adequate network of providers. They can't just have 1 or 2 doctors on their plan in a city. They have to have multiple providers for a plan to be adequate. Greater transparency and medical loss ratio. So a lot of different rulings. You can read up on those. We're not going to cover all of those today for the sake of time. I know I've taken up enough time, so thank you so much for checking this video out. Please share it. We are here to educate and inform, and if we can help you in any way possible, save money on your prescriptions, your Medicare supplement coverage in this time of economic uncertainty and inflation, please reach out to us. We are Senior Solutions Group, and we are here for you. Thank you so much.